Hi, my name is Shannon Cook,
I'm Alyssa Baya.
And I'm Jeannie Rodriguez.
and we're fourth-year pharmacy students at Nova Southeastern University, and we will present to you today to and through pharmacy school, a focus on the later years. The purpose of this presentation is to assist pharmacy students to prepare for their P4 rotations while in their early years of pharmacy school and to give them tips on how to succeed during their P4 rotations. These are the objectives, and by the end of this presentation, you should be able to describe tactics for pharmacy students as they prepare for P4 rotations, identify factors to improve fourth-year students' rotation experiences, list resources to assist students with communication skills, and develop strategies for pharmacy students to use when responding to questions on demand. These are abbreviations listed to you for your reference throughout the presentation. So IPPEs. IPPEs are introductory pharmacy practice experiences, and they are rotations in your P1 to P3 year designed to give you early exposure to direct patient care in a pharmacy setting. There are two types of IPPEs, and they are community and hospital. For the community IPPE at Nova, this is during your second year, and it consists of 4 hours per week for a total of 120 hours of community pharmacy exposure. You are going to be typing prescriptions, taking phone calls, and interacting with patients. To improve your IPPE community experience, you can request from your preceptor to do training modules that will be available for pharmacy interns or pharmacists, but as a student, you can take the opportunity to do these and learn disease states and common over-the-counter prescriptions that you will see. You can also request that you can take phone orders or voicemails from physicians or nurses so you can learn how to interact with healthcare professionals and develop the strategy to be able to take prescriptions. You should also learn the management aspect of the business and ask your pharmacist to look at business metrics or learn the responsibilities as a pharmacy manager. For over-the-counter consultations or counseling of patients, there are two resources listed here that will be very good to have while you're on your community IPPE. For your hospital IPPE at Nova, this is during your third year, and it consists of 8 hours per week for a total of 240 hours of hospital exposure. You should familiarize yourself with the automated medication management system and work closely with technicians to learn how hospital workflow goes. You should be able to do the following once you're done with your daily responsibilities, and you can request this of your preceptor. You can shadow pharmacists or technicians and residents, and we suggest that you shadow P4 students at your IPPE site so that you can learn the responsibilities that you will have as a fourth-year student. If you can get exposure in the IV room or learn unit dosing, this would be very helpful to you in the future if you consider a hospital career. You can also attend meetings such as P&T committee, in-services, and pharmacist CE presentations. You can also go to additional presentations by drug reps, topic discussions, and journal clubs given by students to develop your learning. Rounds may also be an option at some teaching hospitals so that you can learn and see if residency may be the right fit for you. A good guide to have while on rounds is the Sanford Guide to Antimicrobial Therapy, and this is available for purchase online, or you can download it to your iPad or iPhone. The practitioner's quick reference to non-prescription drugs is great to have while on your community IPPE, and you can also purchase this online. So knowing your options. So an APPE is an advanced pharmacy practice experience that you will encounter during your fourth year of pharmacy school, and it gives fourth year students the opportunity to apply knowledge, skills, and behaviors to clinical pharmacy practice in a real world setting. For the Nova College of Pharmacy, these are the required rotations that you must complete. You can read online descriptions of each practice site, And for NOVA students, this is available on PEPRX online. You can collect information from P4s or NSU alumni, and you can reach out to them to learn about what these APPEs consist of. And Facebook is a great page for the Nova College of Pharmacy Facebook page, or by word of mouth or emailing people that you know that have experienced these APPEs. You can go visit the practice site, but make sure you set this up ahead of time with the clinical manager or a preceptor so that you do not just show up to the site, but that it's planned out and that you can get a feel for what this APPE consists of. Networking is also a great aspect to APPEs, and most job offers will come from networking. So we recommend that you pick challenging rotations because these are better educational experiences and they force you to study, and you will be more prepared for the NAPLEX by the end of your 4th year. So choosing your rotations. You should choose your rotations according to your area of interest. If you are interested in a residency or a fellowship, you should select hospitals that offer these programs. Below, these are the things that you should do if you are interested in a residency or a fellowship prior to your APPEs. You should join organizations, for example, like FSHP, ASHP, ACCP. These national organizations, if you do get involved, they will be recognized, and they will be recognized by residency programs all over the U.S. You can work or volunteer in a hospital to get more exposure and show that you're interested. You can consider a 2 or 3 month block of APPEs at specific hospitals that offer this. For example, the ACE program at Jackson Memorial Hospital is a residency-like program during your 4th year as a student that will expose you to hospital on a greater level. You can also get the residency book, and that is available online. If you are interested in community or outpatient setting, choose your APPEs based on what you are interested in, whether you want to do an independent pharmacy or if you would like a busier retail setting. There are also interview workshops available at NOVA for free. Specialty pharmacies are also something that you can consider getting yourself exposed to, such as compounding or home infusion or managed care. These are things that you may not be sure if you're interested in, and who knows, you may end up really liking these areas and deciding to go into them. So this is the Get the Residency book, and it is available online. And it's really great if you're interested in a residency, and it will go into what you need to do during your 1st to 3rd years as a student so that you can be prepared. So your pharmacy student portfolio is going to be a collection of your best work in pharmacy school, and it showcases your growth from P1 to P4 year. It's going to include a purpose statement, your curriculum vitae and resume, immunization history, which is important to have since most rotations will request this, a copy of your intern license or organization membership cards. And projects are very important to put in there. You want to display your best projects, your best pieces of work that you are really proud of, journal clubs, patient cases, and poster presentations. And these will also be a good reference for you. If you get an assignment to do a journal club again, you'll have one there for your reference to remember how to do one. You should also consider keeping proof of your involvement as a student, so maybe a calendar of your rotations or a patient soap note. Be sure to hide all protected health information, badges and tickets from meetings or conferences that you attended, and pictures from activities to show your involvement. It is important to update your portfolio as much as you update your CV so that you can show your progress through each rotation and include any new projects you have completed. So now I'm going to pass the presentation on to Alyssa, and she is going to discuss once you have your APPE schedule.
All right, so once you have your APPE schedule, it'll be nice to review a few things that you've learned through pharmacy school. For example, reviewing IV formulations prior to hospital rotations could be helpful. It's good to know some common IV formulations and standard drip concentrations. And a resource you can use for this is a Trizzle's textbook. It would also be nice to review your drug information resources. For NOVA students, you can review your handouts from class. It goes over some electronic resources that you can download to your smartphone or tablet and have with you when you're on rotation. It'd also be good to familiarize yourself with the resources that are available on the HPD library website, the search engines, and some of the drug information databases that you can find there as well, such as LexiComp, clinical pharmacology, and micromedics. These are also common resources that are used in the different hospitals here in South Florida. So now I'm going to show you some screenshots of our library website and the resources that we have available. So right here, I'm going to show you some books that we have on the website. If you scroll down from the home page, you can see we have the DePiro textbook for pharmacotherapy. That's very useful in looking at the different disease states and management and treatment options for them. I mentioned earlier the Trizzle's Stability of Compounded Formulations textbook. This textbook is very good for looking over your IV formulations and reviewing before hospital rotations. Over here on the Decisions Tool tab, you can look through links to help you find guidelines. For example, Dynamed is a good search engine to look for guidelines. And if you have any rotations in infectious diseases, you can go to the IDSA guidelines or to the CDC website to find guidelines there. In the tab that says databases, you can find full text articles or you can find drug information databases. Right here, I've highlighted the clinical pharmacology link, and like I mentioned, that's a drug database that'll have like monographs there, dosing information, adverse effects, good information for specific drugs. LexiComp is another database that's similar to clinical pharmacology, and it has the same type of information. It also has information on some disease states, and there are also some calculators in there to help with creatinine clearance, BMI. It's just a very useful resource. I've also pointed out PubMed. That's a very good starting point to look for full text articles and very useful, especially for literature searches when you're on your P4 year. So now these are some screenshots for some iPhone apps that you can use when on rotation. I've just done the iPhone apps, however, there are many apps available for Android as well. So right here is the LexiComp app. And like I mentioned with the website, there's a lot of things you can get from this. You can get calculators, you can do drug ID, so you can identify the tablets or the capsules, what it is. And you can also look at IV formulations and the stability of the IVs from this app. Micromedics is another app you can have, and it has a lot of information for drugs on there, drug dosing, some clinical teaching if you have to counsel your patients. It's very useful. And the app here that I've highlighted is called Eponyms, and this is a good app if you have any medical terminology or medical jargon that you're unfamiliar with. If you're on rounds and you hear the doctors talking about something you don't know, this is a good resource to go to and look it up. So now I'm going to talk to you about the time you have prior to starting your APPEs. And in this time, it's good to follow the instructions that the Department of Experiential Education gives to you. Here at NOVA, the heads are Dr. Zapantis and Dr. Shepard. So it's good to make sure you follow up on your attestation letters, making sure it gets to your preceptors and your rotation sites. And usually the school will email you confirmation that they sent it, so it's a good idea to save those emails just for reference and for confirmation when you start your rotation. Before starting your rotation, you should email your preceptor at least 4 weeks in advance. Be sure to introduce yourself, let them know the school you're from, what year you're in, and what type of rotation you're on. If he requests, you can attach your CV. It's important to ask about the location and the time that you'll meet on the first day. ask where you should park and if you should bring anything with you, such as your laptop. And if you need any time off, be sure to ask that at the beginning of your rotation and try to offer times to make up the hours if you do need time off. Before starting, always complete any paperwork that is needed from you and try and update your CV after each rotation just to keep it updated. On the first day, always make sure that you know your way, how to get there. Take traffic into consideration, especially down here in South Florida. You don't want to be late on your first day. Complete any necessary modules that your preceptor wants, and if you do have a business card, it's good to keep that on hand on your first day as it would help with your networking. So now I'm going to hand it over to Jeannie, and she's going to give you some tips for what to do when you're actually on your APPEs.
While you're on your APPEs, it's important to note that your calendar will vary from month to month. You should always be proactive during your shift at rotation sites, and remember to be sociable because this will help build relationships for the future. You should always work ahead on reading assignments and any other assignments your preceptor has given you. You should also remember to stay organized, and a good way to do this is to have an agenda with due dates and deadlines. You should also take advantage of any downtime you have while on your rotation, and this includes going through the fast movers in retail settings and going over the OTC drug products, just so you're familiar with how they look and what is available. If you're on a hospital rotation, you could also take advantage of your time and look at the IV bags and see what volumes they come in and what they look like. It's also important to be prepared on your first day. This includes bringing cash in case you need to leave a deposit for ID badges or purchase any parking passes. You should be aware that you can and will be asked questions about anything you've learned throughout your time in pharmacy school. You should develop strategies to answer questions when you're put on the spot. And a good article to read beforehand is called The Art of Pimping, which we will present next. When you do not know an answer, you should respond intelligently and offer to look it up. An example of this is answering, "I don't know the answer, but I would be happy to get back to you tomorrow." You shouldn't guess unless your preceptor gives you permission. And remember to give follow-up answers in a timely fashion. You should also consider having a small notebook on hand so you can take notes throughout your rotation. This is a screenshot of the article called The Art of Pimping, and it illustrates strategies that are great for students to implement when answering questions on the spot. It also offers insight as to why professors and preceptors challenge students in this way. Here we've provided some citations for really good resources on communication skills. One of these articles is called Improving Communication Skills of Pharmacy Students Through Effective Precepting. This article highlights the importance of practicing communication skills while on IPPEs and APPEs. It promotes students to use preceptors as examples on how to communicate professionally. Next, this article is a tool to teach communication skills to pharmacy students. It has scripts for what students and pharmacists may encounter in a real pharmacy setting, and it goes over proper ways to respond to certain conflicts. This article is the key communication skills and how to acquire them. It shows the importance of good communication skills when talking to patients and the impact you can have on them. It also gives examples of proper ways to respond to patients' needs. You should familiarize yourself with new terminology and medical jargon and look them up for your own knowledge. Don't be afraid to ask relevant questions. However, be mindful of the timing. For example, you don't want to ask a question during rounds. You should wait until after they're finished. Be cognizant of interactions between the interdisciplinary team, and you should always follow the order of command. For example, you don't want to overstep the resident by going straight to the attending physician with an intervention. You should also be open-minded to the various personalities that you will encounter and always communicate in a professional manner. This includes professional attire, body language, and eye contact. Consider each rotation a month-long job interview. Since pharmacy is a small world, you should always be punctual, be enthusiastic, act courteously, and dress professionally. Express gratitude to your preceptor for the time and guidance that they've provided throughout the month. This helps build relationships and leave a positive, lasting impression. You should also be mindful of the other staff that's helped you, such as other technicians, pharmacists, nurses, and physicians. Thank you emails and cards are also a very positive gesture on your part. It's also important to plan for a healthy work-life balance. You should remember to take care of yourself, remember to go to the gym, and keep up with your hobbies. Stay involved in the community, and don't forget to spend time with family and friends. However, always remember to prioritize your time. After each rotation, you should reflect upon the events of the month and think about what you liked and disliked of each rotation. Also, don't judge a field of interest due to a single experience. One disappointing experience at one site doesn't mean you should generalize this to the entire field. You can also add contacts through networking sites such as LinkedIn and ask preceptors for their willingness to write a favorable recommendation letter on your behalf. It's good to note that if you don't get an A on your rotation, you won't get a letter of recommendation. Keep lines of communication open because they may consider you in the case of a new job opening. Continuously strategize for your NAPLEX and MPJEs. You should study smart, whether this includes you studying individually or as part of a group. RX Prep or Pronto Pass are very good preparation materials. Focus on the most common diseases first and practice writing down the names of those diseases as well as medications for the writing portion of the NAPLEX. You can use mnemonics, charts, tables, and auditory aids to help you memorize any necessary information. Another good resource, which is highly recommended, is the MPJE packet from NSU. Congratulations on making it this far. You're almost a pharmacist. Now we'd like to leave you with a quote from Dr. Seuss. You have brains in your head, you have feet in your shoes, you can steer yourself in any direction you choose. You're on your own and you know what you know. You are the guy who'll decide where to go. We'd like to take this chance to thank Dr. Gauthier for giving us the opportunity to reflect upon our journey through pharmacy school as we created this presentation. Here are the references. Thank you.